Hey guys, so we're going to go through the bones and bony prominences first. The first one is the occiput, external occipital protuberance, and superior knuckle line. So you want to put your fingers behind your ears, okay? And you're going to palpate that bump called your external occipital protuberance. And then if your index fingers are horizontal, you're going to feel the superior knuckle line just lateral to the external occipital protuberance, and if you go up and down you'll feel it. So again, this is trail 1 around the globe. Number 2, parietal bones. Okay, so parietals, both hands on the top of the cranium. Okay, this is the sagittal suture, and just lateral to that and slightly inferior would be the parietal bones. Okay, and if we slide inferior from that towards the ears, just anterior to the ears and over top of the ears, we're going to be on the temporal bone. Okay, now to go to the mastoid process, we want to slide behind the earlobes, slide directly down, and you're going to feel that bony prominence right here, which is the mastoid process, where the sternocleidomastoid mastoid attaches. And then the styloid process is anterior to that. Here's my earlobe. If I slide posterior into this soft tissue here, there's a more sharp bony prominence. That's the styloid process. Okay, and then the last is the zygomatic arch. Okay, right in the middle of your ear, slide forward. Here's the zygomatic arch, basically your cheekbones. Okay? Okay, next we have the frontal bone. Okay, so if we start on the parietal bones and slide anterior, we're going to slide right onto the frontal bone. Makes up the top of the eye orbit, and of course your forehead. Okay, comes back to about here. All right. And then we have the facial bones, of course, our nasal bone. Most of your nose is cartilage. My nasal bone starts right about here. And then I have the zygomatic, which is your cheekbone. Okay, right here. Maxilla, upper jaw, where the upper teeth attach. And then we have the mandible. Okay, the lower jaw. Lower jaw, the mandible, the lower jaw. Okay, so we have the body, the base, the submandibular fossa. We have the angle. If you follow the base back, the angle is right here. And then we have the ramus, which is at the angle, between the angle and here, right where your masseter muscle would be. And then we have the condyle and the coronoid process. The condyle would be right where your TMJ joint is. If you open your mouth, you'll feel the condyle move. And then the coronoid process, I have to find the middle of my cheek or my zygomatic bone, slide down, and then I open my mouth and the coronoid process will push into my finger. Right here. That's where the temporalis muscle attaches. Next we have horseshoe trek, which would be trail 3. So we have the trachea, okay? The superficial windpipe, okay? So as you can see on my trachea, you can notice the Adam's apple, okay? Right here. Okay, also known as the thyroid cartilage, okay? And then above that we have the, hyoid bone, which is a horseshoe-shaped bone, okay? It's a floating bone that attaches to your suprahyoids, which are above the hyoid bone, and infrahyoids, which are below the hyoid along the trachea, okay? So right here, I'm on the outside edge, and I'm pushing my hyoid bone, medial and lateral. Okay? Okay, next we have the sternocleidomastoid, okay? The name tells you exactly where it attaches. Sternum, clavicle, and the mastoid process, okay? Let's talk about action. Unilaterally, it laterally flexes the head and neck to the same side. It rotates the head and neck to the opposite side. So when I rotate left, it's my right contracting. Bilaterally, it flexes the neck and also helps assist in elevating the rib cage. The origin, there's two origins, right? One is the top of the manubrium right here, okay? And then we have the medial clavicle, okay? Medial 1/3 of the clavicle here, all right? And then the insertion is the, excuse me, the mastoid process back towards the superior nuchal line and the occiput, okay? So if I rotate my head to the left, you can see here's the mastoid process insertion. Here's the clavicular attachment. I'm sorry, no, this is the sternal attachment right here. And then the clavicular attachment is right in here. Okay? Okay, next we have the scalenes. So I'm just going to read the first paragraph. Well, we have the anterior, middle, and posterior scalenes. The three scalenes are sandwiched between the sternocleidomastoid and the anterior flap of the trapezius on the anterior lateral neck. Their fibers begin at the side of the cervical vertebrae, dive underneath the clavicle, and attach to the first and second ribs. During normal inhalation, the scalenes perform the vital task of elevating the ribs, upper rib, two ribs, okay? If you look on page 246, you'll see how the brachial plexus is invested in between the scalene muscles, okay? So how do we find the scale? Well, let's talk about the action of the scalenes first. So they unilaterally, they rotate the head and neck to the opposite side. So when I rotate to the right, it's my left scalenes right in here, okay? And they laterally flex the head and neck to the same side, okay? Bilaterally, they flex the head and neck, and they elevate the ribs during inhalation. Okay, so I'm gonna show you how to find them generally. Okay, so I'm gonna rotate to the left, or I'm sorry, to the right. You can see the edge of my sternocleidomastoid here, the anterior edge of my trapezius here. So the scalenes would be right in between here, okay? All right, attaching to the rib. So the anterior scalene origin is the transverse process of the 3rd through the 6th cervical vertebrae and the 1st rib. The middle scalene is the transverse process of the 2nd through 7th transverse process of the cervical vertebrae and the 1st rib. And then the posterior scalene is the only one of the 3 that attaches to the 2nd rib. So it's the transverse process of the 6th and 7th transverse process of the cervical vertebrae and the 2nd rib, okay? So the anterior and middle would be in this area. The posterior would be more back here towards the anterior edge of the trapezius, okay? Next we have the masseter. Okay, the masseter is the strongest muscle in the body for its size. It can exert, both sides can exert pressure of about 150 pounds. And what the masseter does is it elevates the mandible, okay, closes the mouth, helps in chewing and talking and swallowing. It also may assist in protracting, bringing the chin forward, jutting the chin forward. The origin is the zygomatic arch, right here. And the insertion is from the angle of the ramus, from the angle to the ramus of the mandible. So if you clench your teeth, you can feel about 1 inch to 1.5 inch muscle right here. Okay, there's two bellies, one's interior and one's exterior. You can palpate the exterior, but you can't really palpate the interior from the outside. Okay? Next we have the temporalis. Okay, the temporalis runs above the ear on the temporal bone along this area. Okay, it comes down and attaches to the coronoid process here. So it elevates the mandible, closes the jaw. It helps in retracting the jaw backwards, pulling the jaw back. The origin is the temporal fossa and fascia, which is up right above here. And then the insertion, like I said, is the coronoid process and the anterior edge of the ramus of the mandible. Okay, so again, closes the jaw. If you put your finger just above your ear, gently palpate here, and then clench your teeth, you can feel it. Okay? Okay, next we have the suprahyoids and digastric muscle. Okay, I'm just going to read this. The suprahyoids, geniohyoid, mylohyoid, and stylohyoid, form a wall of muscle along the underside of the jaw, stretching from the edge of the mandible to the hyoid bone. They lie inferior to the glossus muscle, which are the muscles of the tongue. Even though each of the three suprahyoids is quite small, collectively they affect the tongue and hyoid bone. Okay? The suprahyoid bellies cannot be individually distinguished. Well, it's very challenging. Then there's the digastric muscle. The long, round digastric muscle is composed of a posterior and anterior belly. The posterior belly runs from the mastoid process to the hyoid bone, and then from the hyoid bone to penetrating through a stylohyoid, then loops through the tendinous sling right about here, and then comes to the anterior belly, which attaches under the mandible right about here. Okay, let's talk about the action of the suprahyoids. Action of the suprahyoids. Elevate the hyoid bone, okay? So if you swallow, you'll feel the suprahyoids pull the hyoid bone up. If you press your tongue on the roof of your mouth, you're going to also feel the contraction. They depress the mandible. The origin of the geniohyoid and mylohyoid is underneath the mandible, okay? Underside of the mandible. The stylohyoid is the styloid process right in here. The insertion, of course, for both is the hyoid bone. The digastric muscle, as we talked about, with the hyoid fixed, it depresses the mandible. Okay, pulls the opens the mandible down, and then with the mandible fixed, it elevates the hyoid bone. It also helps retract the hyoid or the mandible backwards. Origin, mastoid process deep to the sternocleidomastoid and splenius capitis. Inferior border of the mandible. Right in here. So here, and then here. That's the digastric. So if the suprahyoids are above the hyoid bone, the infrahyoids are below the hyoid bone. So they run from the hyoid bone down along the trachea. Okay? I'm going to read this. The infrahyoids are located on the anterior neck superior to the trachea. All four muscles are thin and delicate and function as antagonists to the suprahyoids. The superficial sternohyoid and sternothyroid are layered just to the side of the trachea. And although difficult to distinguish individually, they're directly accessible. Deep to these two muscles is the thyrohyoid. As the name suggests, it spans from the thyroid cartilage to the hyoid bone. The omohyoid is perhaps the most bizarre muscle in the body. It has a skinny ribbon-like belly running from the hyoid bone, passing underneath the SCM, okay, and the scalenes to attach to the scapula. Aside from depressing the hyoid, the omohyoid tightens the fascia, okay, of the neck and dilates the internal jugular vein. All right, so the action of the infrahyoids depress the hyoid bone, which would be pulling it down, and the thyroid cartilage also. Sternohyoid, sternothyroid attached to the top of the manubrium. Okay, that's where the origin is. Thyrohyoid, thyroid cartilage right here. And then the omohyoid, superior border of the scapula. Insertion, sternohyoid, thyrohyoid, and omohyoid all attached to the hyoid bone. Sternothyroid attaches to the thyroid cartilage. Thyroid cartilage and the top of the manubrium. And then the sternothyroid, thyroid cartilage. Thank you. So to feel the infrahyoids contract, all I have to do is place my fingers along the trachea and swallow. And I'll feel those infrahyoids contract, okay? Okay, platysma. The platysma is a thin superficial sheath spanning the anterior neck from the mandible to the chest. The platysma and other facial muscles are integumentary muscles. Instead of connecting to bones, these muscles are embedded in the superficial fascia and attached to the skin and overlying muscles. Okay, so the platysma assist in depressing the mandible, pulling it down, okay? Tightens up the fascia, of the neck fascia, and it draws down the corners of the mouth. Okay, so the origin is the fascia covering the superior part of the pectoralis, right in here. Okay, and then the insertion is the base of the mandible and the lower part of the face, right in here. Okay, next we have the occipitofrontalis. Occipitofrontalis muscle is a muscle it's really two muscles, but they're connected by a aponeurosis called the galea aponeurotica, which runs along the scalp, under the scalp. And the occipitalis attaches to just below the eyebrows and elevates the eyebrows when we contract it. And then the occipitalis, if you place your fingers on your occiput and lift your eyebrows, you'll feel a gentle movement. Okay. The frontalis raises the eyebrows and wrinkles the forehead. Occipitalis anchors and retracts the galea aponeurotica, so it basically acts as an assistant for the occipitalis. They both originate on the galea aponeurotica. The frontalis attaches to the skin superior to the eyebrows, right here, and then the occipitalis superior nuchal line. Okay, the next one. Medial and lateral pterygoids. Okay, these are deeper muscles, hard to palpate. Got to go inside the mouth to palpate these. The medial and lateral pterygoids assist in the masseter and temporalis with movement of the mandible. The medial pterygoid helps to elevate the mandible, while the lateral pterygoid protracts it. The medial pterygoid is located on the interior side of the mandible. The lateral pterygoid has horizontal fibers that extend from the sphenoid bone to the joint capsule and articulate with the disc of the temporomandibular joint. Excuse me. So the medial pterygoid, unilaterally, it laterally deviates the mandible. to the opposite side. So when I bring my jaw to the left, it's my right shortening. Bilaterally, it elevates the mandible and protracts the mandible. Okay. Origin, medial surface of the lateral pterygoid plate. Okay. Sphenoid bone and the tuberosity of the maxilla. So that's the upper attachment on the inside. And then the medial surface, insertion medial surface of the ramus and the angle of the mandible, or the medial, right in here. Okay. So it mimics the shape of the masseter, but it's inside, underneath. Lateral pterygoid, unilaterally, it laterally deviates the mandible to the opposite side. So when I go left, it's my right, contracting, shortening. Bilaterally, it protracts. Okay, that would be jutting my jaw forward. Superior origin is superior head is the infratemporal surface and the crest of the greater wing of the sphenoid bone. Inferior head is the lateral surface of the lateral pterygoid plate of the sphenoid bone. The insertion is the articular disc and capsule of the temporomandibular joint, the neck of the mandible. Okay, so this muscle is more horizontal, whereas the medial pterygoid is more vertical. And the last two muscles are the longus capitis and longus coli. Okay, these muscles these muscles run underneath of the trachea. Okay, so they are on the anterior surface of the neck, cervical spine. Tucked between the trachea and the cervical vertebrae, these are two muscles, longus capitis and longus coli, attaching from the anterior surface of the cervical vertebrae to the occiput and atlas. They laterally flex, rotate, and flex the head and neck. They also help to reduce the lordotic curve of the cervical vertebrae. Each muscle has a multi-branched design similar to that of the erector spinae muscles of the back. Okay, so longus capitis, unilaterally, it laterally flexes the head and neck to the same side, rotates the head and neck to the same side, and it bilaterally flexes the head and neck. Origin, transverse process of C3 through C6. Transverse process, insertion is the inferior surface of the occiput. Okay, so the capitis attaches to the skull. Longus coli, unilaterally, laterally flexes the head and neck to the same side, rotates the head and neck to the same side, and bilaterally flexes the head and neck. Origin of the coli, longus coli, bodies of C5 through T3, transverse process of C3 through C5. The insertion is the tubercle on the anterior arch of the atlas, the bodies of the axis, C3, C4, transverse process of C5 and C6. So to treat this muscle, I would have to push the trachea away and go behind that.